Hi, my name is Clarissa Giebel and I'm a researcher at the University of Liverpool. Today I'm going to give you a very brief run through of our COVID-19 care home study, where we specifically looked at safe care home visitation in different care homes across the UK. We specifically looked here at how visits were allowed, and we've conducted a longitudinal qualitative study. So in October-November last year, we conducted remote interviews with 26 family carers of people living with dementia residing in care homes, and interviews with 16 care home staff. Now, these care home staff were from 16 different care homes, so we have a broader spread. So in total, we've done over 40 baseline interviews, and then a few months later, in March 2021, we conducted 20 follow-up interviews with a subsample of those initially interviewed. And it's really important to note that from early December onwards, vaccination was rolled out across the UK. And in that time period between baseline and follow-up interviews, there was generally a rollout of vaccination, but also increased testing in care homes and in the general population. So this will feature in the findings, particularly of the follow-up interviews. But I only have a little bit of time, so I'm trying to give you really the key findings so far that are in press or published already. So looking specifically at those baseline interviews, one of the primary outcomes that we found, which we didn't anticipate, was that fine balance that care home staff apparently seem to tread between providing adequate care and well-being, but also managing the infection risk and their reputation. That reputation angle in particular was unexpected. So we've heard from many family carers that their perception was that care homes, many care homes, not all, were more concerned about their reputation and really keeping family members outside of the care home. So out of all the people that we interviewed, very, very, very few were allowed to actually see their relative face to face. And that was only if these relatives, so the residents with dementia, were at end of life care in the care home, or in very few circumstances when the mental health of the resident with dementia was deteriorating so noticeably that staff picked up on this. Then in some occasions, care home staff allowed that family carer to come in or to have a greater range of alternative face-to-face visits, as we would call it. So alternative face-to-face visits were via window visits or pod screens, so with something in between, so the inability to actually touch or hold hands with the resident with dementia. Another finding was the severe changes to the job role. So it's not only about what has impacted on the residents, what's impacted on the family carers, but also it's important to highlight that the severe changes that care home staff was witnessing, was living through. And it's important to note that in the UK, we did not have any clear guidance on how safe care home visits should be conducted or on how care should be provided during the pandemic. So staff was faced with sourcing PPE, administering COVID tests, and looking after the entering the test results, etc., enabling those alternative face-to-face visits, as well as enabling digital remote visits, which normally wasn't necessary before the pandemic. Family members or friends could come into the care home, visit their loved ones, but now this all had to be really organized. A lot of staff sickness as well as overtime. This led to huge demands on the emotional well-being of staff as well. And it's important to note just how badly in most instances staff has been affected. And just a quick focus on the follow-up interviews that we conducted in March 2021, we noticed that there seemed to be a shift in the emotions experienced by family carers in particular. because all family carers were vaccinated, but they still were not allowed to enter the care homes. Yet they witnessed that in many circumstances, COVID was still making it into the care home, and also that staff, some of which was unvaccinated, was being close to the relative during alternative face-to-face visits, for example. So family carers went from being upset about the situation to angry about the situation. And here are also just a couple of quotes to show the vaccination reluctance we've witnessed in some of those care home staff, but also in care home staff that they were talking about, that they were working with. So again, this is just a quick snapshot, and I hope this is of interest. Thank you very much.